First, I want to say a personal thank you to the Archbishop. He has been so generous. As you know, we use the chapel for our meetings, and you've just been wonderful to help us out there. So thank you so much, and would you please come and
Thank you. It's a real privilege to be here today, and a continued collaboration with what we do and what happens here at Safe Haven. Let us pause for a moment of silence to remember that we're in God's presence. Loving and faithful God, we are grateful for the many ways you show your love and your care in our lives. As we gather today, we ask your blessings upon the people who will come to Safe Haven and those who are here seeking healing. Heal them of mind, body, and spirit. Reassure them of your love and presence in their lives. Strengthen their families as they walk with them. Enlighten all those who serve on the staff of Safe Haven and the administration. May their work be effective in caring for all who come here and lead them towards healing and wholeness. Lord, we ask for your continued blessings upon the residents of St. Tammany Parish, President Pat Brister, and all in public office, especially those gathered here today. And Lord, we ask this in faith, for you are God, living and reigning forever and ever.
Thank you so much. I want to introduce the people that you will be hearing more from in a moment, but I wanted to take a moment. Director Carroll is here with us today, and he is the director of the U.S. Office of National Drug Control Part. There we go, all of that. But he's the drug czar, and that's what we like about his being here. He spent a lot of time with us already, and we appreciate you being here, and you'll hear more from him in just a moment. Our very own St. Tammany, Senator John Kennedy. We're so happy you're here, and he is responsible for putting this together today, and we thank you for doing it. And our Senator Jack Donahue, with his help in getting us here, can never thank him enough. So you're going to be hearing more from them as we go forward. But I just do have a few comments to start. Certainly, I want to welcome everyone today as we make a significant and exciting milestone in the history of Safe Haven. As most of you know, the Crisis Receiving Center will serve as the anchor for the entire Safe Haven campus, or the facility. When this facility opens, we hope that many lives will be changed as residents experience a new dimension of behavioral health care, and as we implement a new approach of providing this care here in St. Tammany Parish. Right here, within the bones of this building, literally bones of this building, that has laid dormant, we will soon see and hear the sounds of hope, help, and help echoing through the corridors. The Crisis Receiving Center represents the way to mental health care for a great many. We're proud to stand here today to mark the beginning of its future. A future we can now see getting closer and closer, thanks to the hard work and efforts of not only St. Tammany Parish government, but of every invested public agency, first responder, nonprofit, hospital, healthcare provider, and resident who has stepped up and to create this collaboration of on-site and network-based partners to create a healing environment. We are proud to stand here today to mark the beginning of the history-making future. We started this project for specific reasons. The present state of behavioral health care is fragmented, expensive, and oftentimes ineffective. Statistically speaking, 1 in 5 adults in the United States will experience a mental health condition. This is just one of the staggering statistics about the state of our health and wellness. The number alone gives us all a call to action. The numbers that hit closest to home are the ones that impact each of us, each of our loved ones, each of our neighbors, and each of our friends, every single day. The ones that take the toll on our families because a mental illness has left a family without their mother or father, or an addiction has left a child in a tailspin, unable to move into adulthood, or we must watch as a family friend copes with the suicide of one of their own. These things happen. They are real, and they happen every day in our community. The cost is not only emotional, but also financial. We all bear the burden when families are broken, when families cannot function, when families cease to be able to care for their own. This facility will address unmet needs to create a seamless thread in the continuum of care. It will serve as a comprehensive, multifaceted program and a single point of entry into the behavioral health continuum for law enforcement, the judiciary, and local area hospitals. Safe Haven will ultimately become a place where all people struggling with mental illness or substance use disorder can come to be assessed, locate services, and ultimately receive the care they need based on the place they are in within their behavioral health journey. The goal of Safe Haven is to elevate the state of the accessibility of behavioral health care. It will gather all of the necessary partners under one roof and give the person in need the best tools that can possibly be located for recovery. It is modeled to create a healing environment for vulnerable individuals at all stages of mental illness. It will give early access to care, thereby reducing the cost of inpatient stays due to delayed treatment. We anticipate that through lessening the burdens currently shouldered by our law enforcement agencies and our emergency departments in area hospitals, as patients will be diverted to Safe Haven for care, that Safe Haven will ultimately save taxpayers' money. It will also lessen the burden on the criminal justice system through access to the specialty court system and diversion from jails, as many people detained in local jails are in need of behavioral health care or reentry alternatives. I really think we're on to something good here. I hope you agree. Safe Haven will be a place where the pieces can be reassembled, where comprehensive care at every stage is the only goal, where people can move through to a brighter season in a humane, multifaceted network of care right here in St. Tammany Parish. Safe Haven will heal. So now it is my honor to introduce the guest speakers. First, as I mentioned, Director James Carroll, and I will say it correctly, is the director of the U.S. Office of National Drug Control Policy. There, I said it right that time.
It's a great honor to be back. I was here a few months ago, and I couldn't wait to come back because so often people focus on the negative. They talk about the 70,000 people who are dying every year. And there are glimmers of hope nationally. What we're beginning to see nationally is for the first time in 30 years, the number of Americans dying from addiction has gone down. But really today, we're here to celebrate. We're not to look at the past, to look just at the number of people dying, but through the work of Pat, the remarkable, miraculous work that's led by Pat here, but then also with such national leaders as Senator Kennedy and the Archbishop, what we have here is the opportunity for a community to come together. And what we know statistically is that communities of faith, when they work together, that God is present and that God is able to change lives and that we're able to go into the community and reach people who need help and say, I'm here for you. At my Catholic church back home in Virginia, Alexandria, Virginia, there's another Alexandria, guys. In Alexandria, Virginia, my wife and I are part of a prayer group, and there's a side chapel. And on the wall it says, "Be not afraid, I am with you." And it took me a while, I am from DC, to realize that that's actually what you all are doing here. And what other communities coming together are doing is you're reaching out to people who are struggling with the disease of addiction and saying, be not afraid, I am with you. It's a scary moment for a person when they're ready to accept recovery and when they're ready to accept treatment. And what you're doing is extending that hand right here, and you're telling them that it's okay. You have people who are in recovery here, so they're peer specialists who can say, I've been there. You have people in the community who say such things as, we're going to help provide housing, food, shelter, and take care of your needs. And that full wraparound services that you all want to provide here is all in the beautiful phrase of God's presence, be not afraid, I am with you. And so when we can talk about the number of people dying, here what we're going to do is talk about the lives saved, about the number of changes that you all are making in your community. You know, Senator Kennedy is known in D.C. and I think known here in the community as someone who is tough and tough on making sure that he's fighting for the people here in the community. And back in D.C., we talk about committee assignments and leadership roles. And really, when I'm back in my home of D.C., which isn't a bad thing, when I'm back home, really what I see is Senator Kennedy being the champion and the leader for empathy and for compassion for his constituents here. I first met Senator Kennedy in my new role about 1.5 years ago as drug czar. And in the first conversation, he started talking about things right here back at home. And what was I going to do to help folks in Louisiana, and of course, here in the home parish. And so we talked about some of the needs. We talked about how the needs here are different than others. This is not a rural, this is not a inner city issue right here. This is more of a rural issue. And it's tougher to find services. And it's tougher to sometimes find people who are able to provide expert services. But what he told me, and I'll never forget, was the compassion and the heart of the people here. And that has been demonstrated throughout my visits here. And so I'm very honored to have Senator Kennedy invite me back and to show me again firsthand from our visit 2 months ago, the last time I was here in the great state, being able to come back and witness firsthand the compassion and the heart and soul of the people of this parish and of this state. So with thanks to all, and a special thanks to Senator Kennedy for allowing me to come to Louisiana again. It's a great honor to be with you. For everyone on the panel, but especially a heartfelt appreciation to Pat. This would not be possible without her and the others up here. And so God bless you all. Thank you for being that hand reaching out to people to say, don't be afraid. Thank you all very much. God bless you.
Thank you, Director Carroll, so much. It is his second visit here. We hope it won't be your last.
No.
So now it's my pleasure to welcome Senator Kennedy, our very own St. Tammany resident. He said in the beginning when he learned about this, I'm going to help you. And he has helped us, and it continues to do so. Thank you, Senator.
I first want to thank Jim Carroll for being here today. Jim is our, when I say our, I mean America's drug czar. I call him Director Carroll because if I call him Czar Carroll, the national media thinks he's from Russia. I can't think of a more challenging time to try to address drug policy, drug addiction, drug prevention in America today. But Jim has done an extraordinary job. And we're already seeing improvement to a very, very difficult social and economic problem. So I want to thank the director for being here today. He honors us, he honors Louisiana with his presence and making time for us out of a very busy schedule. I want to thank the American taxpayer. It won't be enough, but through some HUD disaster grants, which were funneled through the state, about $5 million of American taxpayer money, your money, contributed to Safe Haven. Now, the politicians will take credit for that money. I understand the way it works. I'm a politician too. But it came from the American taxpayer. And I want to thank the people of this country who get up every day, go to work, obey the law, pay their taxes, teach their kids morals, the people like you, for their money. Number 3, what an incredible idea that has come to fruition. Safe Haven was born in darkness. I think Senator Donahue is going to talk more about this, but I remember the day that Governor Jindal decided to close down our state mental hospital here. It was not a good day. It's the maddest I've ever seen Jack Donahue. Safe Haven is now a candle. It's a candle of hope. We have a huge mental health problem in America today. You know that. We see it on our streets. We see it in our emergency rooms. We see it in our jails. There are a lot of reasons for it. I don't have all the answers, but I know this. The problem is not going to be solved by present company excluded, by the smart, virtuous, cultured, cosmopolitan, goat's milk latte drinking people in Washington, D.C. who think they are smarter and more virtuous than the rest of us. One of the reasons Jim is doing such a fine job is he's not part of that club. It's going to be solved by us, by Americans, right in their communities. I'm so proud of this project. So many people contributed to it. I just hesitate to start naming names, but I'd be remiss if I didn't mention Pat Brister. She took a truckload of lemons and turned it into lemonade with the help of a lot of people in this room. She didn't curse the darkness. She lit a candle, and you helped her. I also want to thank one other person. You know, I use this expression a lot to explain politics in Louisiana. I say Louisianians believe in justice, but every now and then we send an innocent man to the legislature. And one of those innocent men is right here, Jack Donahue. Another one, by the way, is our senator right here. Raise your hand, Senator. Yes. And next to her, Reed Falconer. Jack got this phone call. I think it was a Friday afternoon. I could be wrong. But this is his district, saying the hospital is going to be closed. No information about why, no information about savings, no information what we're going to do with the poor souls who depended on this. It wasn't right. It wasn't fair. But once again, Senator Donahue with the president, they could have cursed the darkness. Now, Jack might have cursed a little bit for a while. Pat might have too, but not for long. They didn't curse the darkness. They said, how do we light a candle here? And they've done that. And I am so proud to be here today with them, with the Archbishop. You honor us with your presence. And so proud to be just a little bitty small part of this. God bless all of you. And thank you all for your contribution to this. Some of my colleagues in Washington think that government made America great, and it's government that'll make America even greater. I don't agree with them. Ordinary people like you doing extraordinary things is what made America great. And we'll be fine as a country just as long as we remember who we are. Thank you.
Thank you, Senator Kennedy, so much. Next, I want to welcome Senator Jack Donahue. You've heard a lot about him to this point, and I'm sure you're going to be interested in what he has to say. But first, I'm going to embarrass him a little bit because he has been a mentor for me in this issue. He's a dear friend, he and Maura both. And there are some days that you just wanted to give up, but he was there to help us get through it. So we're here today because he was there with me as we made these decisions. So with that, Senator Kennedy, my good friend, my very good friend, Senator Jack Donahue. Thank you.
I'm not sure who I am. So I wanted to recognize Beth Mizell. I served the last 4 years in the Senate with her. She's a dynamite lady, and we think great things are coming from her. And sitting next to her is a good friend of mine that's prepared himself to serve in the Senate, and I know he'll be there, Reed Falconer. So welcome both of you. So it was July 13th, 2012, at 12:25, when the Chief of Staff from Governor Jindal's office called to tell me that he was shutting down Southeastern Hospital. And you're right, I didn't have anything that anybody could print because I couldn't believe it, that I hadn't heard anything about it. He was closing this hospital. 400 plus some jobs, not just the jobs, but the people that are helped from around the state in this facility. And all those people, where were they going to go? What was going to happen to the 400 people that were here? And I remember I wasn't alone in my anger because Senator Kennedy, who had a bigger platform than I did, let everybody know what he thought about it also. But it's a very difficult situation that we were placed in. We had so many people at risk, and that's a real problem. But it turned out, as things are sometimes in life, it was a black cloud with a silver lining, and that's what happened here. So the business community, the legislative delegation, parish government all came together under the leadership of our parish president, and we started trying to think of what we could do. And I'm not going to bore you with the details because they said I only have a minute. So, but we were able to come up with some ideas, and we promoted those ideas to produce what is now Safe Haven. This is a great campus, and what followed the action was truly remarkable. When you think about it, look at the facility. It's a pretty rough place to begin with. In the state budget, we always look to try to get money to make sure the water was safe in this facility and you could flush toilets. It's a rough place. But, what came out of that dastardly deed on July 12th was people working together to do something for the community. And I just can't tell you how thrilled I am to be able to be part of it. And you've heard Pat talk about it, and Senator Kennedy and Director Carroll. It's a great place. This facility is going to be a triage, as you heard, which is going to be great. People don't always just have to go to jail because they have a mental problem. They don't have to be strapped into a bed in the ER room because they have a mental problem. We have the ability to find out what's wrong with those people and help them. This facility demonstrates what true leadership is all about. I work very closely with Kelly Rabelais. She was mentioned a little earlier, but she gets me passionate about this because she's so passionate. Kelly. You want to embarrass him, get her to stand up, John? So thank you for everything that you do for this facility and the community. I'm a contractor. That's what I've done all my life, and that's really all I know. I'm an engineer by training. I've been in the construction business. And I've seen a lot of people in my time. A lot of people have ideas, but they can't make those ideas work. And I see a lot of people that work hard, but they have no vision for the future. So it's very rare when you find somebody that has a vision and the ability to make that vision work. And that's what we were fortunate enough to have in this parish with our parish president, Pat Brister. She made all of this stuff work. She willed it And because she willed it, it happened. So she's got some great people involved in it now, sitting here at the front. And I think this facility is going to become a model across the country of what communities can do that want to help people that have mental disabilities. So we're very fortunate to have that. Safe Haven has a great board. As chairman of the foundation for Safe Haven, we get to work with that board some. They worked real hard to make all of this a reality. And listen, I'm just thrilled to be here, to be part of it. It's nice to see so many faces that I know for over all these years, and I know how passionate you are about this facility and make sure it's a first-class facility, and I'm sure you will be. Thanks for having me.
Thank you. Thank you, Jack. And I'm sure Senator Kennedy and Senator Donahue thought I might not mention Kelly. Well, of course I will. So Kelly, come stand by me, please. So I'm going to relate a little story. When the word came down and we were all in shock and we thought and met and prayed, Archbishop, we prayed a lot. Met with my staff. Kelly was my legal guide at that point in time. So I said, okay, here's what we're going to do. We're going to buy that place. She said, no, we're not. I said, yeah, we're going to buy this place. And we're going to just trust God. He's going to lead us. We've got the community behind us. And once that was said, that we made our decision, we're going to buy this place, and prayed to God we could find the money. Kelly has not stopped a second, not 1 second, to get us where we are. I rely on her every day. She knows this place in and out, knows all about it. I could introduce many, many more people in this audience, and I'm sorry we don't have the time to do that. But this one has been a godsend, Archbishop, for me, and I thank her every day. Now that I convinced her we could do it. So thank you again. I thank all of you for being part of this historical day. Before we ceremoniously break ground, I would like to ask Archbishop Amon to come up and close as part of our ceremony with a prayer. And Archbishop, I will tell you as you're coming up, if anyone in this room ever doubted, this was a God thing, and we're so thankful to God we have it. Thank you.
Thank you, and let us pray. Merciful and loving God, you are a God of hope and healing. We thank you for Safe Haven. Please give your gifts of hope and healing to all who come here, to those who work here and serve here, and the families of those seeking healing. We thank you for all who make Safe Haven possible. It is indeed a gift from you. Continue to bless this gift. Bless the work of our hands and the love of our hearts. For you are God, living and reigning forever and ever. Amen. And thank you, Pat. It's great to be a part of this project.
Thank you so much. So now we're going to ask our special guest to come up, and Ronnie is going to set them up for the ceremonial groundbreaking.